As discussed in Part 4, your two primary choices for Medicare coverage are with Original Medicare or a Medicare Advantage plan. If you choose Original Medicare, you will pay deductibles, co-payments, and co-insurance costs with no annual out-of-pocket limits. By adding a Medigap policy to Original Medicare or choosing a Medicare Advantage plan, you can greatly reduce or eliminate these out-of-pocket costs. Remember, to get either plan, you must be enrolled in Medicare Parts A and B. Let's look at Medigap plans first. In most cases, with Original Medicare, you can go to any doctor, supplier, hospital, or other facility that's enrolled in Medicare and accepting new patients. Medigap plans do not alter Original Medicare, but are designed to reduce or eliminate the gaps in coverage. Some of these plans also offer services that Original Medicare doesn't, such as medical care when you travel outside of the United States. If you have Original Medicare and buy a Medigap policy, Medicare will pay its share of the approved amount, and the Medigap policy will pay its share of the covered health care costs. Every Medigap policy must follow federal and state laws designed to protect you, and it must be identified as Medicare Supplement Insurance. The different types of Medigap plans are identified by letter. These plans must have the same coverage as designated by the letter, but the cost may vary by each insurance company and the area of the country in which you live. Premiums also vary by the age of the beneficiary, and the cost will change every year as you age. The more coverage you have, the higher the cost for the different Medigap policies, with Plan F having the most coverage and therefore the highest monthly premium. Medigap policies do not have prescription drug coverage, so you will need to decide if you want a Part D plan to be purchased separately. Part D prescription drug plans are covered in Part 6 of this series. If you drop your Medigap policy to join a Medicare Advantage plan and later want to return to Original Medicare and purchase a new Medigap plan, in most cases you will have to go through underwriting and may be declined for health reasons. Medicare Advantage is another health plan choice for the delivery of your health care. These plans are offered by private insurance companies approved by Medicare and will provide all of your Part A and Part B coverage. Medicare Advantage plans are not supplemental coverage. Instead, they are HMOs, PPOs, private fee-for-service, or special needs plans. Each Medicare Advantage plan will charge different out-of-pocket costs and have different rules regarding services. For example, a referral may be required to see a specialist, or you may pay higher or all costs for out-of-network care except in an emergency. These rules may change every year. Medicare Advantage plans may offer extra coverage such as vision, hearing, and dental, as well as health and wellness programs, and most include Part D prescription drug coverage. Every month, Medicare pays a fixed amount for your care to these private insurance companies, and they must follow rules set by Medicare. You will usually pay a separate monthly premium for your Advantage plan, as well as your Part B monthly premium. Like all plans of this type, Medicare Advantage plans have a network of providers. You will choose a primary care doctor from within this network. If your primary care provider leaves the network, you will be notified so you can choose another provider from within the network. If your plan decides to stop participating in Medicare, you will have to join another Medicare health plan or return to Original Medicare. Here are some basic comparisons between Original Medicare with a Medigap plan and a Medicare Advantage plan. Medigap plans are Medicare supplemental insurance offered by private insurance companies to cover some or all deductibles and copays of original Medicare. Medicare Advantage plans are HMOs, PPOs, private fee-for-service, or special needs plans, also offered by private insurance companies to provide Parts A and B coverage. Medigap plans are uniform in their coverage based on the letter designation of the plans designed by Medicare and may be used anywhere in the country as long as the providers are enrolled in Medicare. Medicare Advantage plans vary widely and are governed by their specific plan rules, but must provide all the coverage that Medicare Parts A and B provide. If you go to a doctor, facility, or supplier that doesn't belong to the plan network, your services may not be covered, or your costs could be higher depending on the type of Medicare Advantage plan you have. Medigap policies generally cost more, while Advantage plans generally cost less. We hope this comparison of Medigap and Advantage plans was helpful. Part 6 of the Medicare Basics series explains Part D prescription drug coverage.